Good morning, Dr. Rubina Jasani. The focus of today's conversation really is the impact of the coronavirus on migrant women.
Yeah.
So I'm really happy that you're able to join me today to really think about the impact and the issues that arise. So over to you. Would you like to say a little bit about the work that you're doing?
I have worked on issues of, embodiment, gender, sexuality, but issues of identity as well. Tying into the idea of super diversity in Manchester, I have been working with, I have a project with a community organization called WAST, which is Women Asylum Seekers Together. And it's not a project that I have on my own. It's a project that I have with a fellow academic, Jenna Marie de Lopez, who now works for the University of Bradford. We were really interested. We are both anthropologists. She works on Mexico, I work on India. And we were both really interested in, this whole idea of giving voice in anthropology. Having worked in Mexico and India, I work on violence, she works on maternal mortality. We felt that sometimes when we do intimate kind of fieldwork, women feel like, we are taking their stories, which is sometimes the only thing that they have. So we wanted to change the narrative and we wanted to change the ownership of knowledge. And we started looking at something called peer ethnographic research methods, which is really about collaborative research, knowledge production, and training them to tell their own stories. So that's how I started working with migrant women in Manchester. And I also am associate, because we also spoke about activism and me being a migrant woman. When I moved to Manchester, I was looking for an, activist home, where a lot of my concerns around race, gender, sexuality, come together. I actually found Safety for Sisters, which is also an organization which works alongside WAST, which works with survivors of domestic violence and women who have no recourse to public fund. After COVID-19, we have been working to rally the government and the local authorities. We wrote a position paper on the impact of COVID-19 on women who have no recourse to public fund. And we have been rallying very strongly to get the women who have no recourse to public fund recognized within the larger package of that has been announced for survivors of domestic violence in the country.
I'm aware that the second reading of the Domestic Abuse Bill was saying that actually migrant women were not being recognised within that, and that there was a need to extend provision so that women that had no recourse to public funds could actually access refuge space and financial support and housing. So in the work that you've been doing with women in the community, what has their experience been?
So I think, the national figures, we've seen, an exponential rise in the demand for safety from women. And in the understanding of Safety for Sisters, this is like a gross underestimation. For various reasons. Because women who have no recourse to public fund, migrant women are scared of being sent back to their countries, yes? And the problem with a lot of migrant women is they're not looked upon as survivors of domestic violence. They're looked upon as women who have immigration issues, right? And given the context of austerity and hostile environment, it becomes extremely important that these women are not looked at from the lens of immigration, but are looked at from the lens of being survivors of domestic violence. So in our understanding, a lot of these cases are not actually showing up because women are scared. There is an environment of fear because of the ways in which immigration has been dealt with and the ways in which immigration continues to be dealt with on national television in the middle of the pandemic. And the other fear was, what if we get COVID? because a lot of the women do not have access to do not have access to public funds, and they only have access to primary care. And of course, ICU care becomes secondary care. Yeah, so we've and again, we've been rallying very strongly to make sure that frontline workers actually know that these women actually have access to medical care if need be. And also we've been really speaking about scraping no recourse to public fund as a category completely, especially in COVID times and also in post-COVID times, because we feel that, migrant women should have access to public funds, especially if they want to break away from, it's like a double whammy, because you're caught up in a situation, you're caught up in a home with abusers. And just yesterday we were in a meeting where what we were seeing is a lot of women were getting very mixed messages from local authorities, because nobody wants to take responsibility of actually continuing to stay in really compromised positions of safety, only because nobody knows what to do with them. And that's something that we are saying, simplify the referral process, make it easy for women to get access. And also don't forget the migrant women when you are talking about survivors of domestic violence, because it becomes very easy, as it is, the race agenda has been over the years becoming quite sidelined. And I think that's something that we are talking about in this particular context.
You mentioned Priti Patel.
Yeah.
I'm aware that just on the basic issue of financial support to asylum seekers, not necessarily those fleeing domestic abuse, but regular asylum seekers, she said that there was actually no evidence to suggest that they were struggling to make ends meet.
Mm-hmm.
And that stood in direct contrast to the Women's Budget Group, who produced a report in May earlier this month saying that actually asylum seekers, refugees need more assistance during this time of pandemic, just so they can access basic things like cleaning fluids or just the things that people need to survive a crisis. So I just wondered what your experience, what your research is showing you, or what your conversations with migrant women is highlighting to you in terms of their needs, their current needs as they live through this pandemic.
Speaking about finances, like we know, all refugee and asylum seeking women live on something like £35 a week, right? Here we are speaking about heightened sense of urgency, women not having enough, so all of us went through this whole thing of making sure we have food in our homes. So at Safety for Sisters, people have had to, dish out money, give people extra money. And this should be the state's responsibility, actually. So it's well and good to speak about mental health, but doing the practical mental health work, even during the time of pandemic, requires a very different kind of access to technology, which me and you are able to afford and have, but for a lot of these women, it's an absolute luxury, right? So not only have we had to provide extra money so that people have provisions. One of the things that came out of the meeting, we had a management meeting last night, was how difficult it is to manage, even for support workers, to manage the mental health needs. Colleagues of mine are working like frontline workers, in very compromised economic conditions. I feel like, colleagues of mine are constantly firefighting and are working like frontline workers, managing the needs of migrant women right now.
Yeah, and you've been talking about the psychological impact on the women that you've been working with. But I also wonder if you have any thoughts about the impact it's having on activists like yourself, like ourselves, who are having to step in to fill the gap, actually, especially when you yourself are a migrant woman, separated from your family and living through this time of pandemic.
Yeah, I think I think I'm a very privileged migrant woman, and I'd like to put it out there that I am, very middle class, very safe in my home. Also, I have health conditions, which means that I've had to isolate myself, which means that I'm nowhere out, on doing any of this work myself. A lot of my colleagues have struggled with this whole idea of home, your home becoming your workspace. There are no boundaries anymore. And especially when you're doing this kind of work, right, where boundaries are extremely important. And I feel like activists have had to work in a situation where there are extremely no boundaries, picking up calls on weekends, picking up calls because there's too much distress, right? Right from anxiety of whether I have food, whether I have, money on my phone, whether I'm going to be deported, what if I get COVID? So there is the heightened sense of anxiety. Also, what we were talking about, again, this has been, this gray area, are these women who are working on the front line in this way activists? Are they care workers? Because again, one needs to think about, how we've been talking about health and safety of our colleagues, not only mental health, but also the fact that some of our colleagues are going into this space. So what does it actually mean, right? So there's lots of concerns.
And you mentioned this idea of home and how we protect ourselves and our homes, and our sort of private space, our activist space. But if we think about what we mean by home, as migrant women, what does home mean? What does it mean for you? What does it mean for them?
I've always wondered about the question of home, and I think for me right now the idea of home is suspended. I'm from India. My mom lives in India. I don't know when I'll be able to see her next. I don't like to not have a plan to see my mom, right? And I feel like I've had to completely let go of control, and I've always wondered, but these guys have no control over anything. So how does, so the idea of home is completely suspended. What was interesting was that, WAST as an organization became home for them only because of the kind of support, these smaller firefighting activist, organizations are providing in this city. And, the drop-ins that were organized by WAST, which is Women Asylum Seekers Together, or Safety for Sisters, gave these women the sense of home. And I think what is scary during this time is that that space is not available. That space has now become virtual, right? And not everybody has the wherewithal to access that virtual space. Also, not everybody has the patience to be in that space, because not everybody is feeling the same way, including myself. We are putting the pressure on ourselves because we are all trained into this neoliberal idea of productivity. But we have to understand that that is all suspended. And for women who do not have access to a sense of home, because that sense of home is suspended, things get really worse.
So I think it is important for us all to recognize the impact this pandemic is having on us all. But I think one important, you've made many important points, but one really important point is that sense of community becoming home. And I suppose during this time of physical distancing, we need to think about how we best support each other, even in a virtual space, in order to still create that sense of belonging that being home gives to us. So I think that's a really important point to end on. Also to recognize that we need space to step away from the screen and not be hooked all the time in Zoom conversations, because taking care of our own mental well-being so we're better able to support others is also crucial. So thank you very much, Dr. Rubina Jasani, for the time that you've given us this morning, and all the best in your activism and your academic work.